And a good afternoon to everyone. Permit me to just put my video on so you know it's not AI speaking, and this is really me. I will put the video off shortly, but I hope we've all had a good day. Yesterday was a little bit wonky for me. I couldn't understand what happened with the wind. And then by evening, I was torn between if it was winter coming back or I don't know if anyone has any meteorological report for what happened yesterday. Mervyn, you're normally good with information. Do you know what happened yesterday?
I know.
Yeah, one big cold front, and it's going to last at least another 36 hours, unfortunately.
Oh, shame.
Yeah.
Okay,
Yeah.
okay.
My husband explained to me that the extreme windiness was due to the shift in weather. Because I was like, oh my gosh, is there like a tornado on its way?
The Eastern
Literally,
Cape had snow, I believe.
wow.
Yeah, that's why we're cold here. When there's snow in the mountains, it's always freezing in Joburg. So that's
Oh,
the answer. So if they get
oh,
changes there and there's snow in the mountains, they get ready to freeze. Okay.
oh, okay. So 36 hours. I literally was about packing up my winter dresses, but I had to reach for them today again. So yeah, it is what it is. So I'm going to start sharing and just let me know if and when you can see my screen.
We can see it.
Oh, good. Thank you. Do you still see me? Because I meant to put my video up, but not too sure if I did.
You did.
Okay,
Your
good.
camera is off.
All right then. Afternoon, everyone. So we've had a very interesting series for the past 4 sessions of the professional learning series, and we've been looking at debriefing. Enjoyed thoroughly the session by Nabila, and then we had the session with Lizelle, and that was just off the back of considering the growth mindset with Shira. And I think it's been it's been a steep learning curve for me. You know, as I imagine with most of us, we only start getting equipped to be medical educators when we get into, or health professions educators when we get into the system. And so we come with all our clinician armamentarium and suddenly discover that it's a totally different toolkit that is needed when you are an educator. So this has been for me also a learning curve. I literally have documents on my system and in front of me spread out, and I'm hoping that we would all assist ourselves in learning today. So we'll get stuck into it. It's just 19 slides, just to give us an opportunity to have a very robust conversation around feedback strategies for us as health professions educators. Please give me a thumbs up if you can hear me nicely. I'm not too sure if I'll see thumbs up now that I'm sharing my screen, but Christine confirmed that I'm not lost in trans.
Yes.
Oh,
We
good,
can
good.
hear you very clearly.
Okay, good. So the first thought that came to me, and that's why I have the cow chewing in the on the screen, was, the whole process of how cows will chew the cud. And fun fact, they actually would have a 50-gallon for abdomen. They've got 4 different parts to their GIT, and they will chew the cud for 8 hours, and they can store up to a bathtub full of cud. That was info for me. So I'm going to share a screen that will allow us to just describe our understanding of feedback in a 5-word maximum sentence or phrase, the first thing that comes to mind. So if I was listening, it would have been the whole cow situation for me. So please let me know if you can see the active screen. You can scan the QR code. You can go to menti.com and just put that number in, and I hope it gives you access. Oh, good. Thank you. So improvement. Okay. We've got one person on. Your understanding of feedback, what comes first, and you can upvote, thank you, of what comes to mind when you think of feedback without, overthinking it. So like I said, for me, it was just that whole cow situation. I literally was scouring the internet looking for a cross-section of a cow and wanting to use that as a metaphor for feedback, observations, hindsight, how to do better next time, reflection, and you can upvote anyone else's improvement again coming through, useful information for improvement. If we had a word cloud, I imagine improvement will be sitting right in the middle. Useful info for improvement. Well, today's series is cut out nicely and neatly. Okay, we will just give...
Dr. A, remember
Yes,
to click
please.
enter so that we can start the voting.
Okay, doing that. Okay, good. Clicked. Thanks, Christine. So we have 11 people on, and you can upvote or downvote, whatever, or make comments. So improvements, observations, hindsight, how to do better next time, reflection, improvement, useful information for improvement. Okay, so it looks like we're all on the same page around, what, when we start thinking of feedback, we're literally thinking a process, and we're thinking of how to improve process, person, task, whatever. We'll get to see what literature has for us. Just waiting to see if we'll have one more. Otherwise, I would move on. Okay, let me get the screen out and down. And then, so for today's session, I had gone, there were three very, well, there were four of them, but they're very useful reading resources. And Christine, if you don't mind sharing the links to the resources on the chat, please. On your own, you can go through. The very first one that I found quite interesting was the article by Hattie and Timperley, and they had gone through exploring the concept of feedback in education. It's more or less a conceptual paper, and they tried to define feedback, or not try to define feedback, but they had looked at feedback as information provided by an agent. That could be a teacher or a facilitator, a peer, even a resource like a book or AI, I would add, in this time and age, that would consider aspects of, performance or understanding. And they had gone through the whole process of feedback and signed it up to a three-step process that would, provide info around current level of performance, compare it to a goal, and provide strategies or actions. And they also went into details in the different types of feedback, which we would look at much later in the presentation, and the impact of feedback. One thing very strongly that came out in this paper, and I think is important for us to know from the get-go, is that there is a very strong, because this was a meta-analysis as well, and they had looked at hundreds of papers that involved engagement with educators and learners in their thousands. And they had found out that there is a very significant impact of feedback on student learning. It could be positive or negative. But for that strong effect size and for the very powerful influence that it has, I think that's one of the reasons why we want to make sure that whatever feedback process or engagement we're having, that we make it as effective as possible. The other was the AMI guide. There were two AMI guides that helped just to situate the teacher's role or the facilitator's role, and then bring feedback in. And the last paper that I'm also going to refer to is an instrument. And I remember one of the things that stuck, for the past three series, Mervyn always had a very important question at a point to say, how do we as educators get feedback on what we are doing, or even get feedback as we give feedback? So this paper, Mervyn, please. This Wi-Fi can be problematic. Can you still hear me?
We
couldn't
did
for a
lose you for
while.
a minute. You were
Okay.
exciting the fourth instrument.
Okay. Yeah. So the just trying to say that with this paper by Johnson et al., it had proposed a very interesting tool that helps us to evaluate feedback the way we give it, and could be a very useful tool going forward as we respond to the query that has come over and over about how do we as educators evaluate our own teaching and learning, or the feedback that we give to, or the engagements we have with students. Okay, so moving slides. Okay, so one thing that helps position the reading for me is the fact, like I mentioned from the get-go, this is an excerpt from one of the Amy documents. As clinical teachers, or here health professions educators, we take our role as teachers of future generations, and I put doctors in parentheses because it could be pharmacists, OTs, clinical associates, nurses, whatever student cadre in the health professions system, seriously and with enthusiasm. I can't imagine that for the fact that this is always patient-centered, or that we don't want to be enthusiastic about who we're teaching, knowing that our lives or the lives of our loved ones could be in their hands literally in the near future. But the challenge is that most of us lack knowledge of educational principles and teaching strategies, and that may inadequately prepare us for this additional professional role. That was by Wilkerson and Irby. So there's just been this assumption that professionals who have graduated from medical schools and undergone postgraduate training can automatically start teaching the day after they graduate. And I have come to learn in the past 5 years of this journey of medical education that it's a totally different field and milieu when it becomes, when you get into the role of learner and teacher, or learner and facilitator. So there are, one of the Amy guidelines spoke about a 3-circle outcome, a Dundee model for teachers in the clinical environment that reflects on teachers' tasks in terms of doing the right thing, the approach to teaching, doing the thing right, and the teacher as a professional, the right person doing it. And this I found very interesting because it also helps us to reflect on ourselves as educators in the environment of learning, especially the clinical environment. Are we doing the right thing? Are we doing the thing right? And are we positioning ourselves as the right people to do it? And for each of these 3-circle outcome models, you'll see that feedback is always a central core. Providing feedback is part of doing the right thing. Knowing and applying principles of effective feedback is part of doing the thing right, teaching right. And soliciting feedback on teaching, like Dr. Jacobson would always consistently harp on, is part of ourselves upskilling to be teachers that are professional at what we do. So I hope that by the end of today's session, we would have received some supportive info to help us do the right thing, do the thing right, and be the right people to do those things. So what are important concepts regarding feedback? We've spoken, in our Menti meter, we've all spoken about improvement the whole concept of improvement was central in the feedback that we gave. But some important concepts we need to just also add to the whole context of improvement, of context of feedback, is that there is info provided by an agent. And that agent, like we said from the get-go, could be ourselves as educators, could be a book resource, could be a peer regarding aspects of one's performance or understanding. One critical thing we're going to find out when we get into the types of feedback is that feedback that just speaks to, and Lizelle had mentioned that just says, and good job or fantastic, which is something I do very well, is at the lowest level of feedback, because it doesn't really speak to performance, it doesn't really address understanding, and is a bit, superficial. And the whole concept of the fact that feedback speaks to consequence of performance. Feedback must be within a learning context. So there must have been some engagement prior to giving feedback, or engagement ongoing, and then one is giving feedback in that context. Feedback also shouldn't, one of the things that came through is using the word did, DID, as opposed to using the word IS. So it doesn't address personal, a person or a personality or something we think is wrong within the way a person projects whatever learning encounter they're having, but it looks at the task, it looks at what is being done, it looks at performance. So at the core of feedback is the consequence of performance. And it can be powerful when it addresses interpretations that are faulty, or it can easily slip into becoming threatening and closing up the whole learning encounter when it hasn't been contextualized within learning engagement. Please, at any point, Christine, let me know if there are questions or comments in the chat that need for me to...
I can read one from Daniela Goeieman.
Okay.
And it's actually something that was quite shocking for me.
Yeah.
Shame, some colleagues are forced to be clinical educators, even though they communicate that they don't have the capacity to teach.
Mm-hmm.
Sometimes there is feedback is dismissed and they don't have an opt-out because the site is a teaching site, or their feedback is dismissed.
True that. Thanks, Daniela. Just hoping that, that I don't know what to call that now. That gap is addressed somewhat by the sessions we've been having in this learning series, and that people who find themselves in a role where they are taking up the health professions educator space will begin to give feedback that is effective. So this slide literally just summarizes the main purpose of feedback. A student or a learner, the whole concept of what their current understanding must be clarified from the get-go, and we'll look at that when we review the tools. And there is often a gap between what the current understanding of the student is and what the performance outcome or the goal expected is. And that's where the health professions educator comes in. Effective feedback would reduce this goal. We will see when we get to review the theory. One of the theories of social constructivism speaks about feedback in the zone of proximal development. So you understand what the learner has to move from a space where, there is little or no understanding of a concept to a point where, with support and with some level of hand-holding, they're able to engage and try to construct knowledge around facts that we are providing or that we are co-creating, or knowledge that we are co-creating in that partnership of learning and facilitation. So feedback needs to reduce that gap. But if we don't, as educators, understand where a student is in terms of current understanding, we can't give effective feedback. If all we have within our crosshairs is the goal or the performance that is expected. So effective feedback must answer 3 questions. And that's where the analogy of the cow comes back to me again. It must answer, where am I going? And this is both for the educator and the learner. So goals must be clarified. And that's called the feed up. So when we look at the tools, we will see that giving feedback, like we said, doesn't occur in a vacuum. So we need to clarify from the get-go, no matter what the engagement is. If it's just to take a history, if it's to learn how to script appropriately, if it's antimicrobial, being cautious of what the guidelines are around antimicrobial therapy, if it's how to communicate breaking bad news, or whatever it is that encounter is targeted at, or what the learning outcomes are, it must be clear. Feedback is going to be effective. It must be clear from the get-go what the goals are, and that's the feed up. So if we're going to give feedback, we don't jump into what progress is being made towards the goal, which is how am I going? The second question. We need to be sure that the goals have been clarified before we get to how am I going? And then finally to where to next. And Lizelle had spoken in a sense to this last week. So whenever we are in a session, and we call it a feedback session, we need to have these questions at the back of our minds, and we also need to ensure that the student is aware that we're going through 3 processes, like a 3-fold cord. We need to be clear what the goals are, a feed up. We need to be able to identify clearly, both the educator and the learner, what progress is being made towards the goal. And we need to also be clear in that feedback that there is a feed forward. What activities need to be undertaken to improve progress? Otherwise, it becomes an empty process. Remember, I know that we've always had that idea of the sandwich process. So we're no longer just feeding sandwiches. We're no longer just putting cheese on crackers or mush or marshmallows on whatever, or a spread on bread. We need to feed up, feedback, and feed forward. And I'll just pause for
Dr.
that.
A,
Yes, please.
we had 2 comments from Jennifer Hull and Daniela Goeieman again.
Good. Please read them.
We learn to be teachers when we remain in the teaching environment. We learn and see what is understood and what needs to be changed. This is from Jennifer Hull.
True.
And again from Daniela Goeieman. The more specific you are, the better. The more you notice what's meaningful to a person, the greater your potential impact will be. And she also has a reference there.
Yeah. Thanks, Daniela. And and that brings, maybe before I go forward, one of the things identified in one of the Emmy guidelines was the whole concept of the 12 roles of a clinical educator or of a teacher. And it speaks to this: when we are reflexive, when we are able to ourselves be good learners, when we are able ourselves to know how to process student contacts, teaching expertise, the student at a distance, medical expertise, and break that down to actual people's skills, then feedback is just a portion of that whole concept of a 12 role teacher. Thanks, Daniela. Thanks, Jenny. Okay, so feed up, feedback, feed forward. 3 critical questions or components of effective feedback. Okay, so sorry. Next, we're just going to, I had an opportunity to speak to a few students. I wanted to just get their sense, what they also thought as learners, what they expect in terms of feedback. We will watch a video. I did get consent from them. And these are, if you recognize them, yeah, they are students. I didn't interview my own students because I knew there was going to be a bias. Okay. Please let me know if you can hear.
We can't hear it.
Can or cannot?
Cannot.
Okay, let me go back and just give me a moment, please. It means I didn't. Okay. Can you hear it now?
Your screen is not sharing.
Okay. Okay, let me stop this. Thanks for the feedback, Christine.
Pleasure.
Let me get this share. And
Your screen is sharing again.
okay,
Sound is working.
fantastic, thank you.
Hi, I think feedback should be something that will progress you.
I think feedback should be objective.
I think feedback should be like positive criticism and ways you could improve.
Okay.
Oh, wait. I think feedback is not only about positive progression or maybe positive report back, but also maybe the mistakes that you make and what you could do to correct the mistakes as well.
Okay. And then just to ask one last question. What do you think feedback should, with all you've said, in the long run, how should that feedback work into your learning or the lecturer's teaching?
Okay.
Yeah.
I think it should change the way I approach my studies or how I learn things. So maybe if I got feedback from the lecturers that I missed something while reporting back, then I should work on that. Feedback should be a learning curve.
Anyone?
Okay. And for just to note, I got them impromptu. I just said to them, guys, are you happy to help me? I want to learn, from the students' perspective, what they think about feedback. But they were very helpful. Those were BCMP students. So we are
Dr.
going to,
A,
yes, please.
Daniela has her hand up.
Oh, Daniela, please go ahead.
And I wanted to say thanks, Dr. A. I'm marking 2 of the students' assignments now. Thank you for helping me. Now I know what I need to say.
All right, then, no worries. So going forward, Hattie and Timberly, this is the model of feedback that will enhance learning. Remember, we've all been doing feedback, or what we think is feedback. We literally have the WBAs where it has this little box at the end of the mini CEX that says feedback. And most times it's empty, preceptors would not feel, or we would put it in and then I know, for myself in the past, I may just go ahead and just give a criticism without working that into the whole, thing of feed forward and feedback and then feed forward. But like I said, this has been a learning curve for me. So this is a model for feedback that enhances learning. One is that we clarify the purpose of feedback. We want to reduce discrepancies. And it was so interesting, and we'll see another video by GEM students, that the students seem to have a handle on what they expect that really literally aligns with what literature provides in terms of effective feedback. So feedback, the main purpose should be to reduce discrepancies between current understanding and performance. Remember that whole diagram. So if we don't understand what the current the student's current knowledge or the learner's current knowledge is, because this could be clinicians, this could be at a postgrad level, we can't speak effectively into what the desired goal is. So we must be clear, and the learner or whoever is receiving feedback must also be clear that we want to, if there is a discrepancy between current understanding and the desired goal, they should know what the desired goal is at the point of feedback, and they should also be clear on what their current understanding was. And then the model recognizes that this discrepancy can be co-creatively reduced. So this is not something that just empowers the educator or positions the educator in a place of an unequal or unfair power dynamics where you're the one who knows it all. No. Effective feedback literally has both the educator or the teacher or the facilitator and the learner reducing that discrepancy together. So for the students, it could be the fact that they will, when you give feedback effectively, they would recognize that, okay, I need to increase my efforts, or I need to, change my strategy, or I need to be more effective in an existing strategy. Could be to reinforce something that they know already. Or on the flip side, the student could, remember, feedback could have both a positive and a negative impact. The negative part of it is that a student could abandon the process altogether. They could, blur the lines around, this is feedback for growth, this is formative, this is meant to help me, bridge or reduce a gap or a discrepancy, and they can end up lowering their goals. So for teachers or for facilitators or for educators, we need to, if we want to reduce that gap, we're looking at how do we create an ideal learning environment? How do we ensure that the experience for the students helps to answer those 3 questions? Remember the questions, feed up, feedback, feed forward. Where are we going? What's the goal of this process? Okay, we're learning how to take a history. We're learning how to palpate an abdomen appropriately. We're learning how to do an appropriate counseling. We're learning how to do the things that they do in how the right way to do balance movements or to correct a postural issue, or we're learning how to, for an OT, engage with patients or people with special needs to maximize their life or their quality of life. So always those 3 questions are the core of effective feedback. And then, very importantly, is that we need to recognize that there are 4 levels where these feedback questions will work. So it's not just about the task. So there is task level feedback. There is process level feedback. There is self-regulation level feedback, and there's also self-level feedback. And the authors recognize that, what we normally do, those personal evaluations that speak to affects. Oh, that was fantastic. That was awesome. Or that was bad. That was not good. That was, what did you just do? Those ones that speak to affects, most times positive, because, or negative, it depends on who's wearing the hat, do not produce much in terms of change or reducing that discrepancy. But when we focus on the process, understanding the process, understanding how to perform the task, understanding what the end goal is, then those feedback at that level produces more change or produces more effective change. So the 3 feedback questions, and how do we relate this to medical education? This is a little bit of theory, and I know for those who are currently going through the health science education, you may have done the module on theory of medical education. That was my, I'm so sorry to say if she was on the call, but that was my toughest module because I had to grab this whole concepts of philosophy. Saber, I know you're currently going through. How did you find the theories of medical education module?
Hi, Anastasia. Yes, I would like to concur. I found that to be the one that was more tough for me as well. But finally got to grips with it.
Yeah.
Thanks to Shira.
Yeah, thanks to Shira. And it keeps making sense the more we step away. Like literally the coin is still dropping, but it made more sense when I stepped away from, that acute pressure situation of learning. Ane was my classmate and peer supporter. Ane, do you remember our days in the HSE course?
I remember the system shock. It took me 2 years to recover.
I don't know if this is Shira on the call. This is us giving feedback on a
She knows. I'd so many times told her, look, when I'm past my PTSD, then I'll come for the masters.
Okay, so sorry if we've left out a few people, but yeah, there is a lot to learn in the HSC course, and one of them is how to go down to the theoretical underpinnings of how learners learn and how teachers teach and how environment and multiple other layers affect learning. So for the feed up, there is this theory of goal setting. And here, the implications are it's not just about, popping out an Olwazi document on what the objectives of the module is. We need to be sure, or we need to ensure that our learners understand that for every engagement, it's a procedural or a skill session. It's a session that is knowledge intensive. It's a psychomotor domain learning in terms of doing something, or even with professional, attitudes and the affect when they deal with or relate with students or relate with patients. They need to understand what the goal is, and the goal setting must be a co-created engagement between learners and educators. I'm mindful of time, but feedback, again, the theory of self-efficacy. There are lots of students, and particularly for me, I can speak from the experience of the Nelson Mandela Fidel Castro students. They have a lot to deal with, transitioning between different environments of learning, different learning scenarios, different systems, health systems, and they take quite a bang around, their belief in themselves. I don't know how it is for other educators, that you find sometimes an individual within a class has problems relating their identity or their belief in their capacity to learn, the role, the professional role that they're in. So when we go through feedback, when we go through answering the question of, I'll just flip back to the other slide and reminding ourselves of what that question around how am I going, it helps the students, or it helps the learner to understand, and maybe for ourselves as educators, like Daniela had mentioned earlier on, when we are forced into a space where we suddenly become educators, if we do this on a peer level, we can get to a space where we explore our self-efficacy and our belief in our capacity to be better educators. And of course, the feed forward. So the theory around social constructivism literally speaks to knowledge is better when it's co-created. So that whole concept of I'm the professional, I'm the one who has the knowledge, and you're the empty vessel I have to pour into, is, sorry for the word, but it's crappy. We need to always understand that everyone comes to the table with something. And as educators, part of our role is to find out what does the student know and how can we move them to more? Where to next? How can we look at enhancing challenges? How can we get to more information and how they understand that? We're almost getting to the end, but the focus on feedback that we spoke about is task level related. So there must be feedback about the task. So clearly understand. So this is not about the student doing the task, but how have they performed the task? What's the gap between the desired way they should perform the task and what they've done? And they should understand that you're giving feedback to that. The processing of the task, the self as a person, least effective, and then self-regulation. How can they own their learning space? Like I said, the reading material, Christine, I'm imagining it's already in the chat for people to engage with.
Yes.
So the last video we will watch, also from students, literally encapsulates a lot of.
So
Let me start it from scratch. Please, can you hear it?
Yes, we
maybe
can.
like in,
Okay, good.
in us,
Yeah.
I think maybe like in history, like, okay, don't tell me what I don't know.
Yeah, like I think sometimes for ASCIIs, for me, I would prefer we get a pass or fail, and then the following year we get our mark. But I sometimes wish I can see the rubric, and I understand that there are some people that will study according to the rubric, but I would like to see what I can specifically improve on, instead of like this year doing the same mistakes again because I didn't know it was something that I should be doing. Or for instance, like a history, am I making enough eye contact? So
Please feel
where
free
we
to
have
put
like
comments
5
in the
minute start
chat
and a 1
as you
minute
listen to the
marking, I
students.
sometimes wish there's then another minute where you go back in and they say, okay, these 3 things you can improve on, and this is how. Or like the way we have like a follow-up session for
It was
a
similar,
test.
it's similar to how when we had FOSCIs in Game 1.
Yeah.
It helps
So a
lot,
few of them
but
didn't want to
after you
appear,
do
so
so
that's why
whatever
you're
it
seeing the
is,
trees.
then you can have actual feedback as you're doing so real time.
Yeah.
So it's not like you're coming back and you can't remember what it is that you got wrong.
Yeah.
It's right there, and then you can study harder. I think that would help a lot.
Yeah, and definitely the more feedback the better, because it aids the learning process.
Yeah.
I find that with exams also, I know there's difficulty with the questions being like out and doing the rounds, but the more feedback we can get on our exams, theory exams also, the better.
Okay, so this is like from the feedback coming from the teachers. What of the feedback, how helpful do you think teachers or facilitators getting feedback from you is?
So for me personally, we rotate a lot with our lecturers, so we are Game 2 students, and every like, for instance, like basic science, one block would be one lecture and the next one would be another, and I often wish there was kind of like a immediate poll, like a QR scan code thing after the lecture, because simple things that sometimes I struggle with is that there's either someone asks a question and the lecturer gets sidetracked, and then we need to go self-study the rest of the lecture, and you came in to attend the lecture, or that the lecturer speaks too slowly or too quickly and you can't follow the concepts, because I'm very much an auditive learner. So for me, that is a big aspect, is to have like more immediate feedback, because we used to, when we had Josh DeVeems last year, he used to like send out these feedback emails after the block, but by then you can't remember if there was a specific topic that was an issue. So it's, for me, I would enjoy more feedback like on a daily basis,
Maybe
and
per
then
lecture.
yeah, per
Every
lecture.
there could be just some simple feedback from students as to what they found, good about the lecture, and maybe what could help them even better.
I think also with regard to the feedback, it's also that there is a communication problem between like UMI and our actual lecturers. So even if we give them feedback, they can't do much with it. Like a good example was earlier this week, I mean, with our class trips, we've organized or agreed that certain lectures would be recorded, and that's not always communicated to the doctors. So I think also with the feedback in that aspect, there should be a better communication so we're all on the same page with it.
But like also the immediate feedback, it would be better to have it, like you're saying, after the lecture, because then the lecturer will know, oh, I did this lecture. Tomorrow, if I have a lecture, then
I
it
can
fix
it.
it quickly. And a lot of the time, when we have those emails, a lot of us just like, oh, I don't want to. Oh yeah,
holidays. So
yes.
like we
And
didn't
they're
want
pressing
to.
us to like, please give feedback, and it's like, oh, I'm too lazy. So if it's immediate, then you remember that, okay, I remember this lecture.
Or
Let me do
even
this differently.
if it's too difficult to have like a QR code per lecture or whatever, they can maybe have like a system where you log it, and whenever you experience a difficulty, you can log it. Because for me personally, I've experienced like working via the class reps, a lot of people need to have an issue before it gets sent up the food chain, and then obviously we don't always want, like, I don't want to look like I'm constantly complaining if I send something, so it would be nice to have like an anonymous system where it's a link, you can go in whenever and be like, okay, this didn't work today, is it possible that it can be fixed? And you don't necessarily need to get like feedback from your request, but know that it is sent up and someone hears it, basically.
Okay, and then just one last question. We have about 1 minute into the video before it stops. Do you think feedback is only about criticisms or complaints?
No,
it can also be
very useful
to help you to do better, and so you can learn. I think that's the best part about feedback, is that you're learning your mistakes, and it's better to have feedback now and learn from our mistakes before we actually get into the clinical settings and do those mistakes on real patients.
Yeah, and I think especially like we have, we're all in a clinical skill group together, and we've experienced in the hospital with methods where it's very uplifting if we have a doctor that actually tells us, okay, well done guys, you did a good job today. So also like the compliment, yes, and also where they sometimes every now and again we get a doctor that kind of remembers where we are at in our learning progress, because they sometimes compare us to a specialist, which we obviously are not. And then to have that where they compliment you and say, okay, no, we know it's still very far to go, but for where you are, we are proud. So that is also like the positive energy and the feedback side as well.
But also like on their part, like it would also be nice to be like, oh, you know, your constant you know, affirmations and making us feel like, oh, we're not just, you know, useless or we don't know anything. It's better. Like I would be like, thank you to the doctor.
Thank you so much, guys.
Okay. Sorry, trying to drag this back. Now I'm struggling to drag my screen back. Okay.
Click on the minimize button at the bottom right corner.
Okay, good. Now, thanks. Okay. So any comments? What are we hearing from the students? I mean, we've looked at literature, we've had the first group of students, now we've had the second group of students. Is there anything anyone at this point wants to say in terms of previous practice? We're also giving ourselves feedback, you know, looking at where the gap for us as educators. Are there comments in the chat or anybody wanting to say something at this point?
There are some comments in the chat, but I'm going to ask Daniela to speak because her comments are very insightful.
Daniela, please go ahead. Daniela? Okay, have I been kicked out by Vit's Wi-Fi?
No, we can hear you.
Okay. All right.
The next person was also Anne Orchard. Or was it a nay?
A nay. It's okay. My comment is what I introduced into our course is like a hybridized FOSCI, where because I want to ensure that for our screening program that we have throughout the campus, I wanted to ensure that the students are actually indeed ready to go. So I introduced a pre-OSCE, but now it became a FOSCI where the students would actually do the FOSCI in pairs. And they'd have like multiple stations at like one person. So it would kind of, each student gets 15 minutes to do multiple skills on their fellow students. And the students would come before they go into the assessment area. They are given the rubrics that gets used so that they can see, where do I get marked? Oh, okay, maybe I need to remember this. I don't usually remember that. So they get exposure to the rubric beforehand. So they all know how they're being marked, what they're being marked on, and what they're going to be expected to do. They come in, one student gets 15 minutes to perform everything, switches over to the other student, 15 minutes. And then once they've both had their 15 minutes, each student gets an opportunity to give the other one feedback.
That's interesting.
And then after they've both given feedback, then the facilitator gives feedback to each of the students. And then after that, the students will have marked it, and we mark it via, okay, you are ready for steps, or you are not yet ready. Thus, you need to please attend some more revision and reattempt the FOSCI. So over there's so much feedback, and I personally find it has been like very valuable for the students. I am hoping to carry out a study on it, but that's one of the things that I've implemented for our course.
Yeah, that sounds super interesting. I can imagine your students will love you for that, because it literally breaks down that barrier around. So traditionally, I know that it's always been this whole thing of students don't know what the rubric or what the marking scheme or what they're up against, but that's gradually changing. So this is very interesting, Annie. Thank you so much for sharing.
Welcome. And it's like so unnecessary to keep that from them, even for all the assignments and projects I have for my students now, the rubrics are given before, like they know exactly how they'll be marked. It's like, why hide these from the students? I can understand for ASCII, but like the students should know, like, what am I being marked on? What should I be aiming for? You know? Yeah.
That's interesting. Thank you so much. So, are they,
Daniela's hand is up.
Okay, Daniela.
So sorry about that. I was busy with something else. It's just I wanted to just ask, not to speak to what I put in the comments, but I'm just trying to follow the feedback we're talking about. Is it the content is this, because I'm thinking about a clinical educator, is it things that are happening on the clinical side, or is it more feedback in terms of what we do here in terms of written assignments? Just some clarity before I make my comment.
So literally everything, every level of engagement, whatever task it is, so giving feedback is always part of doing the right thing, doing the thing right, and then so clinical or non-clinical,
Yeah, because I mean the students highlight something about the turnaround of the feedback, and I'm just thinking in the clinical space where at times we see so many students, you know, certain colleagues, and this is why I always talk about how we see interprofessional education and who can evaluate you. Because if I think at some of the, for example, just take into consideration history taking is something that we all do as health science, what do you call these things? Health science as health professionals, right? So other members of the clinical team, so where and I think to myself, unit managers or senior nursing staff who are encouraged, who can be encouraged to assess the student, and that the capacity to then do a particular skill that is done by all healthcare professionals, where we kind of see ourselves as, because I'm part of this profession, because this is my scope of practice, I'm the only one who can then assess. But if the skill is so general and it's done by all of us and we all believe in the certain standard and the competencies, I sometimes then wonder, you know, for example, I think about an OSA that we do, or an OVA for diabetic foot exam. If other health team members are taught that exact same examination, if I'm thinking about the fact that and it goes back to my question about colleagues when they say they don't have the capacity, I know there's some people who are dying to step up and teach, but then they look to say, you're not part of my cadre, therefore your competencies to then teach and even then evaluate is flawed. And then I think to myself, well, then how do we ever get to then assess even the students' teamwork and interpersonal skills and capacity to collaborate in a healthcare setting if we then ourselves teach in silos and assess in silos? Where's this well-rounded, patient-centered approach to evaluating students going to come from, and collaborative skills going to come from?
True. Thanks, Daniela. Very insightful comments, and I'm sure it's like food for thought going forward. And it's literally one of my last slides in terms of how can we then improve as a team and not siloed in our approach. How can we literally model interprofessional learning even within ourselves and in the different cadres? So, Christine, can I go ahead? Is there another hand, or?
Mervyn had his hand up for a second.
Mervyn, please go ahead. I've been waiting to hear your voice.
Thank you. This is such a stimulating conversation, and in fact, an hour doesn't do it justice. My question is, and it's based on ignorance, do we ever get feedback from our patients or the people with whom we work to find out how they felt about the experience? And therefore, can we learn from that interview how to make it better? Thank you.
Thanks, Mervyn. That literally is the next slide, because I had you very strongly on my mind, because I know that's something you're very passionate about. So this here tool, the feedback quality instrument tool, is a tool developed by some researchers as not too long ago, 2021, They had also gone through lots of literature and research on feedback. They had analyzed available tools and again, harping on the impact, the very strong impact feedback has in education, and the fact that we're all doing it differently, or that, you know, standards around what's ideal. There are like, I remember with the debrief session with Nabila, she had shared the PELS tool for debriefing. And maybe there are tools that are other tools that are available that other people don't have access to. So what this instrument speaks to is literally an instrument we could use within ourselves. And it has 5 core components: setting the scene, analyzing performance. Those are parts or ingredients to practically giving feedback. Planning improvements, fostering learner agency, fostering psychological safety. The last 2 have to happen, you know, through the session. If it's a verbal feedback, if it's a video feedback, if it's a written feedback, we must always ensure that we're promoting, you know, a dialogue where the learner feels this is not just about my facilitator or teacher saying to me, you did this right or you did this wrong, but where there is an encouragement for the learner to, and I like that example that Anne spoke to. I think it's a very interesting model where students would actually in real time, they do that, you know, involuntarily or unconsciously every day in their small groups. But going forward, if we could look at, and, you know, for time, this also is available in the reading resources, where we look at the different items that we would then get evaluated by another educator, you know, just looking at how we're giving feedback. So I'm going to, for time, skip to the last slide, where we will say what are the implications for us, and that's listening to you, Mervyn, and also the comments that have come through. One of the suggestions is to have video clubs. So Mervyn, with, of course, the learners, like I had to take consent from the student that I did the video on. We could have a video session of a session where we are giving feedback. If this is an engagement, a clinical engagement or a skills engagement, or something happening in the sim lab, and we're giving feedback in that teaching session. And then, obviously, with consents, we have maybe in this learning series, or we have a little club, like a journal club, like the DFMPC has, where people who are interested will submit their videos, and we would all effectively give feedback. So not just condemning or praising, but go through the task, go through the performance, go through, you know, those 4 levels of engagement, and asking those 3 critical questions: feeding up, feeding back, and feeding forward. We could then improve on ourselves, and we could get feedback for how we give feedback, or get feedback on how we teach, or get feedback. And those clubs could literally have students who are willing to be a part of it and give feedback. I found this video, or doing these video sessions, they were very brief with the students, very insightful. They literally summarized literature in terms of what they expect is effective feedback. So Mervyn, are you up for us looking, you know, stepping away from this session and literally looking at, can we have, or the CHSE helping us to facilitate sessions, capacity development sessions, where educators or people who are willing would do, you know, videos with consent of them giving feedback or teaching, and we all come together and just review and effectively give feedback. That's 1. 2, we could have role play sessions, you know. So for that research document on developing a tool, and I'm mindful that we're 1 hour over, we could literally curate different videos and just speak to that. I know I've enjoyed sessions with Nabila where she would bring videos of Grey's Anatomy or something, and then have people critique, have students critique the engagement between the patient and the healthcare provider. On that note, and like you mentioned, this is just to get us thinking and reviewing our methodologies around giving feedback. These are the references that I've used. And I want to thank you all, and thank you for this session. Any feedback at this point?
Anastasia, please can you go to the previous one? I just want to take a picture of the references you used.
Okay, good.
Cool.
All right then.
I love the session. Thank you.
Also,
thank you. Yeah.
Do add your email in the chat room if you would like me to share the slides with you.
Yes, please. Oh, okay. This is to others. Okay. So it's a canvas. It's a Christine, would you be able to handle the fact that it's Canva? Okay.
Yes.
Okay,
I can
good.
download it as a PDF and email it to them.
Okay. Thank you everyone for, I don't know if we have comments in the last few minutes. We're past 5. But happy to take comments and also get some effective feedback on if, the session, if it was helpful.
I found it particularly insightful, especially the practical ways people do give feedback.
Jenny? Thanks, Christine. Jenny, I note your hand is up as we...
Speaking already and didn't turn off my mic. Thank you for the session. It was very interesting. I think the one thing that always strikes me is that even when we're doing the interviews, there's some people who don't want to put their face to what they're saying. Yeah. And I think if we do comments at the end of the lecture, it must be something that's anonymous. So they don't actually comment there. They can put it on a chart or whatever we're seeing, so it goes back to the people. And they don't feel that they are being judged or held to ransom for what they've said. Thank you.
Thanks, Jenny. One of the things that I found quite interesting, the students spoke about a QR code. We could make it a very anonymous, response from the students. If, like doing that video, 2 of them were explicit in saying, I don't want my face to show. So we could work our way around, how we cater for the ones. Yeah, Annie, go ahead.
You could very easily do that on RedCap, like develop something like that on RedCap with a QR code, because that's kind of what we use for our STEPS program. We've actually implemented a feedback from the patients that we do the screenings for, and there's a QR code for people to scan once they've been through the entire screening process with our students, and we ask them their feedback on the program itself, the students, were they treated with dignity, how do they feel about the knowledge that the students had, like what they've gained from it. And it's all anonymized, so we use it to evaluate the program for the next year to help improve the program and the training of our students. And it's completely anonymized. The QR code works beautifully. And the nice thing with RedCap, it also automatically gives you all the little graphs to show what the, like where the answers are sitting, and it does the stats for you, like a lot of the stats for you that you'd want. Yeah. So that's like totally something that can be done on RedCap.
Okay, amazing. Christine is going to speak with Shira. Let's just look at what we could do so that this isn't just a session. We could co-create the next steps in terms of knowing that feedback is such a powerful tool to student learning. But thank you everyone for being here. And I hope you have a warm evening and enjoy your sessions going forward.
Thanks.
Thank
Bye.
you. Bye.
Thanks, everybody. Bye.